Hello class, you're welcome back to the class. Thank you for being here, hanging on. I hope everybody is following. I'm glad to see that people, the participants were really active, asking questions and writing notes and looking forward to what is to come. I really enjoyed that, and I ask you to continue in that way. When we're active and everybody is participating, it makes it quicker, actually, and more interesting. So thank you for doing that. This session is on ongoing patient care, which is the fourth step in emergency scene management. We have already discussed about the scene survey, which is step 1, primary survey, which is step 2, secondary survey, which is step 3, and now ongoing patient care. So let us go for that. It is going to be short. It's not going to be long. So what is ongoing patient care? Ongoing patient care, even from the name, it tells you that the care you provide to the patient is ongoing. So you don't stop. If there is no reason to stop, you don't stop. Okay? So you have to continue helping this patient until you hand over to EMS. That is what it means. Ongoing patient care means keep on supporting your patient, keep on supporting your patient, keep on assessing or reassessing your patient, keep on monitoring your patient, keep on manually supporting your patient until you hand over to EMS. So ongoing patient care. So this is the last step during emergency management, whereby you stay with your patient, whereby you keep on periodically, you reassess your patient. So remember the RABC. So you have to, when you're with your patient, if you have not handed over to EMS, you have to what? Reassess all those key elements, making sure that your patient is still conscious, nothing has been lost, the airway is still open, your patient is still breathing normally, and then the circulation is still adequate. So ongoing patient care, ongoing, keep on, never abandon your patient before EMS arrives. So this is what ongoing patient care is. So some of the things you do here is to continue reassessing your patient. So you have done that assessment before, so but you need to continue reassessing as long as that patient is with you. Monitor, keep on monitoring your patient, keep on monitoring your patient, okay, and reassuring. So make sure you're reassuring your patient, reassuring. Okay, you reassure your patient. Manual support. So if there are some manual support you are doing, keep on manually supporting your patient. And then, okay, don't give anything by mouth. Don't give anything by mouth. So don't give your patient anything at this time unless you are advised to do so by the paramedics. So don't give anything by mouth. So this is what you do. Stay with your patient is important, very, very important. Stay with your patient, supporting your patient, reassuring your patient, reassessing your patient. Keep your eyes on your patient. and make sure that nothing has gone back, nothing has, your patient has not dropped in responsiveness. You should be able to catch all those. So don't remove your eyes away from the patient. That is what ongoing patient care is. You may need to cover your patient with a blanket. You may need to support your patient manually. Maybe your patient has a fracture or neck injury or head injury. You need to do spinal motion restriction. Those are manual support of your patient that you should continue. Don't let go. Don't let go, please. The only time you go is when you hand over, when you officially hand over to EMS. That is the only time you go. Does anybody have any question? All right, so you can refer to the book for detailed discussion on this, but I believe that what we have covered so far is enough for you to understand what ongoing patient care is. It simply means keep on caring for the patient until you hand over to the EMS. Thank you very much. And then we have now that we have covered the 4 sequences in emergency scene management, it will now give us a very solid platform to build on. We have laid the foundation. The foundation is formidable and solid, so we're ready to build. So we'll be looking at specific emergencies like shock, like fainting, like diabetes, seizures, head injury, many of them are allergic reactions, asthma. We're going to look at them and then see how we are going to use the guideline discussed. So we're going to follow the steps and see how we are going to care for people who have had such emergencies. So thank you very much, and please, if you are watching this from our channel, please give us thumbs up. Okay, you're supporting the channel. You're supporting the channel. If you're not giving up, if you're not liking the videos, you're not commenting, you're not sharing, or some of you that have not subscribed, please do that. Okay, because if you're not doing those, you're not supporting this channel. So, but I trust that you're going to do that. Thank you so much. And I'll see you again in the next session. And next session we'll be talking about shock. Thank you. See you then. Bye-bye.